Yeah, welcome to my channel. Thanks for visiting. Please remember to subscribe. Today is all about potassium iodide. This is a pretty good agent against radioactive poison, useful in emergency situations. Potassium iodide is used for more than that. So today we'll go through all the uses of potassium iodide, the best way to use it, and the possible side effects. Without further ado, let's go. Potassium iodide is a good agent that protects the thyroid gland against radioactive poisoning. Very helpful in emergency conditions against radioactive poisoning. How best can we make use of it? And what are the possible side effects? First of all, let's get some facts right. Though it's on the news that many people all over the world are now rushing to get potassium iodide. It's true, it is an antidote against radioactive poisoning, particularly to protect the thyroid gland. But we cannot just use it indiscriminately. We must follow the public health officers in your jurisdiction, or in some countries, the government will give the directives directly. Either way, just don't jump the gun and be consuming potassium iodide. It might be risky. By the time we'll be done with this presentation, you understand better. You cannot use these more than once a day. Only one dose in 24 hours. You cannot use it for prophylaxis. Okay, there'll be radioactive radiation, because of that, I will be using it from today. No, that is not the way. We will go through the side effects, and it is not what you'll be using indefinitely. So don't pack your house full of bottles of potassium iodide thinking I'll be using it from today to the end of the current war. No. Okay, why am I so concerned about making this presentation? Well, my concern and my business is that there is that likelihood of iodine toxicity or poisoning or iodism when you take potassium iodide in excess or for a long time. And that could lead to thyroiditis. When there is thyroiditis, inflammation of the thyroid gland, that will shoot the thyroid hormones into the circulatory system, leading to hyperthyroidism. And not only that, when the hyperthyroidism has reached a stage and there is no more follicles to deal with, there's no place to shoot the thyroid hormones from, then we'll be down with hypothyroidism. And over a long period of time, there might be papillary thyroid cancer. But immediately, the situation might be mild or moderate, and sometimes could be extremely horrible. So there might be nausea, vomiting, and diarrhea. Some will go into delirium, some will become so weak, lethargic. There may be tests or convulsions, shock, stupor, and some will actually die. So potassium iodide indiscriminate use can actually lead to death. So we should be careful. Now, this agent could come under different brand names, either as SSKI, Tyrosave, Catobel, IOD, Jodid, Alsad, Tyroprotect, or Tyroshield, depending on the one that is available in your jurisdiction or your country. As per the class, it is an antidote, an anti-thyroid agent, and also an expectorant. Uses of potassium iodide. Let me start with the most important one. It's useful as an antidote against radioactive poisoning, particularly to protect the thyroid gland against radioactive poisoning. Also in thyrotoxicosis or thyrotoxic crisis, in thyroid storm, as an expectorant, particularly to increase secretion along the respiratory tract to break down thick mucus in cystic fibrosis. Also in Graves' disease, for individuals that will undergo thyroidectomy, potassium iodide will be very helpful. In cutaneous or lymphocutaneous sporotrichosis, and also in thyroid gland protection during radiopharmaceutical use. Now, the mechanism of action. As per secretion, it increases respiratory tract secretions. With that, there will be decreased viscosity as per the mucus, and that is helpful in cystic fibrosis. What happens about thyroid hormones? Well, it will inhibit secretion of thyroid hormones and also promotes colloid accumulation in thyroid follicles. Okay, the thyroid cancer, and so what? What is going on? Here, it's going to block radioactive iodine uptake, so that there will be no thyroid gland uptake of radioactive iodine after exposure. That's the way it decreases thyroid cancer. Fourth, could be found in form of tablets for per use. That could be in 65 or 130 milligram per tablet, and could also be in form of solution for per use as 1 gram per ml or 65 milligram per ml. When it comes to the administration of potassium iodide, let me emphasize the fact that you can only use one dose in one day or one dose in 24 hours. So you may get a glass full of water or fruit juice or milk so that you can protect the gastrointestinal tract. Then sometimes some brand will come with specific instructions on how it could be administered. So check the brand you have. But you cannot use more than one dose in 24 hours. You may take the tablet whole, or you may decide to crush it and put it in water, milk, chocolate mint, orange juice, soda, raspberry syrup. Even in the case of children, you can use infant formula. What are we trying to do? Protect the gastrointestinal tract and then change the salty taste. When it comes to monitoring, anyone of potassium iodide will want to know what is happening to the thyroid gland, so we'll have thyroid function test done. Is this person pregnant? A woman pregnant will monitor the mother and the fetus. Is she breastfeeding? The newborn and the mother will both be monitored. For clinical state, we'll be looking for signs and symptoms of hypo and hyperthyroidism. Also, renal function test will be checked. Cardiovascular system will be fully examined. Now, in any situation when and where a pregnant woman is involved and potassium iodide is to be used, for example, when there is nuclear radiation, pregnant women or women should be attended to first. We will give this agent immediately. Maybe once we have known through the news or through any means that radioactive materials have been released into the atmosphere, then give the pregnant woman potassium iodide. Okay, priority should be placed on that. If you are unable to get it immediately, anytime you are able to get it, still give it. It's better than not giving it at all. But we cannot give it ahead of the time that the radioactive material will be released into the atmosphere. Then, the wise thing to do is to evacuate that pregnant woman or women from the area. Okay? We cannot continuously be taking potassium iodide. If a pregnant woman is taking potassium iodide continuously, that will suppress the thyroid in the fetus. And you know what that means when the child is delivered. So that is the way to handle a pregnant woman in the face of radioactive radiation. In emergency situations, priority on pregnant women. If a pregnant woman is exposed to sodium iodide 131 in anyone greater than 12 weeks of gestational age, then we can use potassium iodide to survey the situation. Okay, pregnancy potassium iodide as an expectorant. We do not expect a pregnant woman to be on this agent for a long time, even if you are using it as an expectorant. No, we don't. Why that? The newborn will be in trouble. Trouble with what? The newborn can develop goiter. And when the goiter is massive enough, it could compress the airway. And you know what that means? Of course, there may be suffocation, and the newborn may die from that. So, some that will not die from compression of the airways secondary to goiter may run into hypothyroidism. We don't expect a pregnant woman to be on this for a long time. Breastfeeding and potassium iodide. First thing first, we will not expect a breastfeeding mother to use potassium iodide as an expectorant. No. But if it is beyond our control in case of nuclear radiation, that is an emergency, right? We should remember that through breast milk, whatever we give the mother, a lot will get into the infant through breast milk. So first thing first, we evacuate the breastfeeding mothers from the environment, and if it is possible, they can quickly express breast milk. But if it's impossible, and then we give the potassium iodide and they are breastfeeding the infant, we should be expecting in the infant skin rash and hypothyroidism. In Graves' disease, we will not use potassium iodide as an expectorant, no. But if an individual with Graves' disease is planning to have thyroidectomy, or there is thyroid storm or hyperthyroid state, then we can make use of potassium iodide. When it comes to contraindications, let me first of all list them, then I will drop a comment. Hypersensitivity to potassium iodide means we should not use it. When there is nodular thyroid goiter, we are not expected to use it. When there's hypothyroidism, we will not likely use it. Or when there is severe cardiovascular disease, we are not expected to use it. But the note I want to leave here is that we will not be looking at individuals with all these conditions in the face of radioactive emission released from nuclear power plant places. What we can do is we'll take the individual to a medical center where we can salvage the underlying problems like hypothyroidism, cardiovascular problem, the goiter with compression effect and everything, and still administer potassium iodide. But we're going to keep extra watch on the individual, because we can't just say, okay, since you have hypothyroidism, you have severe cardiovascular disease, or you have goiter, then we'll leave you there to die. No, we won't do that. We'll look for a way to salvage the entire situation. To those who use potassium iodide indiscriminately, okay, I want you to get this right. You may run into a big problem. You can have iodine toxicity that can lead to thyroiditis. And when there's thyroiditis, more thyroid hormones will be pushed into the circulatory system. With that, you come down with hyperthyroidism. And over a long time, there'll be depletion of those thyroid hormones, leading to hypothyroidism. For a long period of time, if that is persistent, you can run to thyroid cancer. Then sometimes the iodine toxicity might be mild. You can have nausea, vomiting, diarrhea, and some people will come down with weakness, lethargy, delirium, and some will go into shock and could actually die. Some may have headache and increased salivation. It has metallic taste and sometimes burning of the mouth, burning of the throat, the gums, be burning, and some will go into convulsion. Also remember, there may be hypersensitivity, presenting with serum sickness-like symptoms like fever, enlarged lymph nodes, joint pains, and when laboratory investigation is done, we can pick eosinophilia. The journey of adverse reactions has not ended. It can include increased acne, particularly in younger age group. Dermatitis flares could become, increased, and then thyroid enlargement may occur, then giving us goiter that could compress the respiratory tract, particularly the trachea. And if that is happening in younger kids like newborns, you know what that could lead to. Finally, on possible side effects, apart from eye irritation with eyelid swelling and some skin lesions like dermatitis, like I alluded to earlier, there may be what is known as gasping syndrome in neonates, when part of the formulations will include benzoic acid or propylene glycol. This is likely going to happen in neonates, was in premature neonates, right? So we should be careful if anyone is taking this medication for cystic fibrosis. They are highly susceptible to goitrogenic effects. So we keep an eye on thyroid function test. So all these could happen. And that is why I've advised earlier, don't stockpile potassium iodide and use it indiscriminately. Wait for the announcement by your government or local health authority or public health, because you can run into all these possible adverse reactions. Finally, on adverse reactions, there may be arrhythmias, numbness, vasculitis, there may be confusion, then urticaria, I've talked about goiter and hypothyroidism, and also mesothelioma may be the case. Enlarged salivary gland is a possibility. There may be stomach pain, toothache, gingival pain, or some will have meeting, like I said earlier. There may be dyspnea, rhinitis, or even wheezing. Some will have joint pains. Some will develop all sorts of things, including gastrointestinal bleeding. So be careful. This is not a medication to use indiscriminately. Drug-drug interaction. To those who are familiar with my channel, you know what my answer will be. I'm going to send you back to your primary physicians and your pharmacist, because you might be on one medication that I'm not aware of and I cannot even be aware of, and I don't know new ones that you might be taking. So it's better to have that conversation with a pharmacist and your physician. Okay, to myself, to my colleagues, and to the public, everyone who would like to make use of this or prescribe this to anybody, remember hypersensitivity. Okay, remember flare in acne and dermatitis. Remember the possibility of hypothyroidism, even hyperthyroidism, right? In adrenal insufficiency, be careful. In renal, be careful. In cardiovascular diseases, be extremely careful. Okay, let me scare you a little bit. And that is the basis of this presentation. Potassium iodide is good, helpful as an antidote, right? As an expectorant, correct. As an anti-thyroid gland, excellent. In fact, when you give it 1 hour after anti-thyroid agent like propita, urazi, or metimazole, is very helpful in thyrotoxicosis or thyroid storm, correct. But you can run into iodide poisoning or iodine or iodine toxicity. That can lead to thyroiditis. When there's thyroiditis, inflammation of the thyroid gland, it will shoot out no thyroid hormones. Then you'll be battling with hyperthyroidism. After a long time, there will be no enough hormones to be shot into the circulatory system. Then you'll be down with hypothyroidism. Over a long period of time, you can run into papillary thyroid cancer. You might be lucky that the situation will not be that horrible. It could be mild when you'll be battling with nausea, vomiting, diarrhea, mentality test, headache, increased salivation. Some will come down with test. Others will be weak or lethargic. Some people will go into delirium, stupor, convulsion, or shock. And some will not be able to get back to life, death. So why running into trouble? Why can't we allow the trouble to remain there? If there is radioactive emission, then we'll grab it based on instruction from the public health or the government of our respective jurisdiction or country. Someone will ask me, why are you bringing now pediatric age group and potassium iodide separately again? Well, I have said it in the course of this presentation that we have to be careful. Besides the fact that they can develop goiter, which may be, strong enough to compress the trachea and then suffocate the child and death, in pediatric age group with cystic fibrosis and on these medication as expectorant for a long time, then we should be careful because they are susceptible to goitrogenic effects. Then, Gasping syndrome. There will be a simple presentation on Gasping syndrome, but potassium iodide itself, it will not give Gasping syndrome. However, when the component of formulation involves propyl or propylene glycol or benzoic acid on benzoate, that could lead to Gasping syndrome with metabolic acidosis, and everything involved. There will be separate presentation on Gasping syndrome. Okay, like I started by telling you that we'll go into how to appropriately use this medication. So I'll just give few examples here. Okay, your public health officials or the government of your country will give you instructions on when and how to use potassium iodide if the situation warrants it. Okay, as an antidote, when we're exposed to radioactive materials, it's going to help to block the thyroid gland from taking such radioactive poisoning up. But take instructions from your physicians and the government of your country. An adult could take as much as 130 milligrams once daily, while infants and children less than 3 years will take a quarter of that, that is 1/4, that specifically 32.5 milligrams once daily. But older children that are greater than 3 years up to 12 years can take 65 milligrams once daily. And adolescents less than 68 kilograms will take the same 65 milligrams. That is half of the adult dose. But any adolescent greater than 68 kilograms should take adult dose also. And that could be taken for as long as 2 weeks. Your health professionals in your respective jurisdiction or country will guide you. And as expectorant, the dosage is different, so your physician will guide you. As an anti-thyroid agent, you need that for infants, older children, adults, everyone when you are faced with thyrotoxicosis or thyroid storm. It is better to give this within 1 hour after giving your anti-thyroid agent like Propita, Urazi, or Metimazole. Meaning you would have given your Propita, Urazi, or Metimazole, then you give potassium iodide. And last, so I'm going to leave the last note, but if you look at it very closely, I put down the same thing as first note. So I'm going to repeat the same thing, meaning I'm very, very concerned about these facts here. It is a good agent as an antidote in the face of nuclear radioactive poisoning, no doubt about that. But you can only take 1 dose per day, 1 in 24 hours, not more. So if you stockpile your house with so many bottles of it, you can't take it just like that. No. It is not for prophylaxis against nuclear radioactive poisoning. In other words, because there is fear that, there's war, somewhere not far away, or, like as of today in Ukraine, then I will be taking it to prevent it. No, that is not the way. Remember the possible side effects. These good medication can actually lead to death. If you are taking it too much and you are taking it for a long period of time. Remember, hypothyroidism is not anything to joke with. Hypothyroidism is not what we can play with. And people get into delirium. Some will get into stupor. Some will have convulsion. Some will get into shock. And some could die. It is not to be used indefinitely. That is why I have said, and I'm repeating, and I'm going to end saying the same thing. Listen to your physicians. Listen to the public health officials in your jurisdiction or country. Or, as it may be appropriate in some countries, the government of your country will give you directive on when and how to use potassium iodide. With that, I've come to the end of this presentation. Potassium iodide is pretty good in the face of nuclear radioactive poisoning. But please follow the instructions given by those in authority. Thanks for listening. Remember to share this very presentation. Remember to subscribe to my channel. I've been doing this for close to 3 years. dishing out helpful pieces of information in medical field that could help human race.